we're going to use on this machine, this mannequin. So
apply pad. Plug in pad connector next to flashing light.
So we need to come around so that we can listen and we can see what is. But it meant that this one, once you open it, it was powered on by itself. Okay. So it came. When it came, we're doing compressions. We won't stop. We'll continue doing the compressions.
Apply pad. Plug in pads connector next to flashing light.
So these are the pads, and this is the pad connector.
Apply pad. Plug in connector.
Until you do that, to keep talking, sir. To talk until you do it. Now, if you look on the pads, you see where this one goes to. It goes to just below the right clavicle.
Apply pad.
And
insert connector firmly.
so, and this one comes down here, or up here.
Apply pad. Insert connector firmly.
Okay, so we have to insert the connector.
Family.
Apply pad to patient's bare chest. Stay clear of patient. Analyzing.
So I should stay clear. So if I'm doing CPR, I should stop. Now it's analyzing the rhythm.
Shock advised. Stay clear of patient. Deliver shock now.
Okay, so he says shock is advised. I should deliver the
Press
shock now.
the flashing orange button
I should
now.
press that flashing light. Okay, so then I'll press on that.
Shock delivered.
As many as I'm jump. This is a trainer AED, and this is a mannequin. It's a rubber. No, it won't work. So in the normal human beings, it would shock them, and that movement that happens now on the TV, you see it. Yeah, you see it. It happens. Yeah, they flexes their muscles, so they move something like that. So immediately you deliver the shock. You don't wait for it to say anything. You resume compressions. You don't deliver and go looking for a pulse. No. Immediately deliver the shock. You resume compressions and you do it for that 2 minutes or 30 to 2 5 times.
5 times.
Yes, you do 30 to 2 5 times. That is a cycle. Yeah. Yes, while it's still attached. Okay, so the good thing about when you have the AED is that now you don't need to even count to know when the 2 minutes is up. It will by itself, when the 2 minutes is up, will tell you to stop compressions. So it will tell you in the 2 minutes to hold compressions and to analyze the rhythm again and advise you whether shock is advised or not. Okay, so there are shockable rhythms and non-shockable rhythms. Okay, before I talk about that, before you attach the pad, you must ensure that there's no water on the chest. Because water and electricity, that's fire for you. Okay, so you burn this man very well if you did that. So you had dry the chest if there was drowning and you brought them out, and you dry the chest. If there's any medicine patch in any of these places, you must remove that medicine patch, dry the area before you attach the pad. If there's if there's an AED that you're talking about and the need, say this place, we must move this one away. We can't apply it. So it means
Stop CPR.
means 2 minutes is up. So you say we should stop the
Stay
CPR.
clear of patient.
Stay clear
Analyzing.
again. No, so it's assuming you're doing the CPR. Yeah. So it's analyzing the rhythm again.
No shock advised.
This time it's
Begin
no
CPR.
shock is advised, so we should continue the CPR. So we'll be doing the thing is still there. We'll be doing.
My concern is when it says that stop CPR,
Mm-hmm.
clear, stay clear. Like the time it takes for you to apply the shock, will it affect the patient's pulse or something? Because it takes a long time, about 10 to 15 seconds.
To deliver the shock or to stay clear, or which one?
Stop CPR, stay clear, then analyzing then
The
tell
rhythm.
you to apply the shock. From that time to when you apply the shock, it's about 10 to 15 seconds. Won't it affect the CPR you are doing?
No. So it's been said that if a patient needs a shock and you don't deliver the shock, you can do CPR for 100 years. The person won't come back. It's a shock that they need, because what it is happening is that the heart is beating at some rate or rhythm that cannot perfuse. And you are doing the CPR, you are just buying time so that you know what it is to deal with. So now it's found that is this one that it needs to be dealt with. It delivers the shock, stops that thing happening, and the heart now kickstarts and beats now normally. If you don't do that, you can do CPR forever. It won't help.
The reason I ask is within that, can you still do the CPR continuum when it says apply the shock, then you stop, then you just apply the shock?
As in apply the shock.
So
like when
if
it says stay clear,
if you are doing the compression, it cannot analyze the rhythm. It cannot.
Okay.
Yeah, it cannot analyze the rhythm because you are still interrupting.
Okay.
And even when your body is touching this body, it will analyze your rhythm.
Okay.
And you would have a pulse, or to say no shock advised.
Okay.
But then the person would probably be the one who needs it.
Okay then.
So you don't touch when it's analyzing.
Okay.
It doesn't help.
Okay.
Stop
That means another 2
CPR.
minutes has come.
Yeah.
So you say stop CPR.
Stay clear of patient.
Well,
Analyzing.
Analyzing.
No shock advised.
Once shock is not advised, you continue CPR.
Begin CPR.
So you continue like that till
Till you are tired, then you stop.
till you are tired.
Then you stop.
Or till you've gone through all the reversible causes of cardiac arrest in your mind, you've corrected that you need to correct, and then once you've done that, you stop. Okay. Right. If there's too much, if there's hair on the chest, these parts will not stick. So you need to get the hair out.
That's why we need to
So what they say is that if you have two of this, you can use one, you attach and you yank it, and the hair will come off, and you attach the second one. Well, who did that? You actually you'll be a baby. Or other than that, you need to shave. Have a razor to shave the hair.
So
But
when
in Ghana, we have one. And you use you don't have two to use one to just remove hair.
So when you're doing the CPR and the AED comes,
Yes.
you continue, then they'll be applying it.
Yes.
You don't
Yes.
stop.
You don't stop.
Then they apply it.
They apply it.
Then okay.
when you apply,
Yeah.
then you listen.
Yeah. When
Okay.
you listen, when you finish applying, then you listen to what it will say. Itself will say that stop or clear the patient, and then
Even if you've not done your 30.
Sorry.
So even if you've not done your 30.
No, if you have
Okay, you stop.
any point that you say stop, you just stop.
You stay clear.
Yeah. So in the hospital, what happens is that once the patient has the arrest, you start a compression. Immediately you're able to connect the patient to the monitor. You need to stop and look at what the monitor is showing. If you don't have the AED, you need to see what the monitor is showing. Because in hospital, it's assumed that you may not have access to AED. You need to do the manual one. So you must now look on the monitor and analyze that rhythm that is on the monitor, whether it's a shockable one or not. Okay. So immediately it comes, you get a monitor, stop. Because without you knowing what it is you are dealing with, you won't know the interventions to put in. Because if it needs a shock, as I said, and you don't give the shock, and you're just doing compression, you're wasting your time.
So when do we know? Because we call the ambulance.
No shock advised. Begin
So they are in with
CPR.
Dealing with this.
So we are using it. When do we transfer
The patient. Ideally, the patient should have a pulse before you do the transfer. Because in the ambulance, doing CPR is difficult. And the movement, it's not able to analyze the rhythm. So you are in transit, the ambulance is shaking, it's unable to analyze the rhythm. So it's difficult to say you are transporting the patient.
So it means the surface.
When you are doing the CPR and all that, it's difficult.
It means the surface you are doing the CPR can affect.
Yes, the movements and everything would affect the rhythm analysis.
Okay, because doing it on the floor like this,
Or doing the floor is not a problem.
Okay.
and doing it on the bed
On the
will be
bed,
different.
yes. So the bed, if the mattress is not that thick, that when you press, the whole body sinks into the mattress. Not really that you are doing a compression. There is a body that sinks into and goes in and comes back. The body is bouncing. That's not good. So they have what they call a backboard. That time they put a backboard behind the patient so that it gives you a firm surface.
Oh, okay.
But some of, I mean, the mattress is not that thick. And some of the beds are actually even made as if there's a backboard behind.
Very firm.
Very firm. Yes. So with that, I don't need another backboard or anything like that. Yeah. Yeah. Any more questions on the AED? So this time around, when you get an AED or when it comes, you can operate it, set it, power it on, connect it, and follow its instructions. Ideally, there should be AED everywhere people meet. Yes. Here, there should be one here. That's how come Obi Manso. Yes. Right from the airport to convention centers and all that, you have AEDs there. So that if anything happens, people can use it. I think our Terminal 3, we have AEDs there now.
I think they will have.
Yeah. Any more questions on the AED? That's it. It's a very simple, easy to use machine, but most of people will have it and it's dusty.
Unless emergency comes.
Yeah, because quite a number of people don't know how to use it. That's the problem. Yeah. So now that you know, go and teach them. I'm gonna teach them.
Yep.
I think yes.
I
will need to check again.
Last week.
What the
And there was a monitor connected to it, so you can see it.
I see you for.
Ma'am, say that when you open it, it's covered by it. So you hear it. It will tell you. Once you open it, it will start speaking. By the time if you open it, it's not speaking, you need to go look for the power on.
Every corner we are there.
Any more questions on the AED?
It's on the wall.
All right, so we've been able to look at the compressions. We've looked at the airway, opening the airway. We've looked at doing the breaths, giving the breaths. And now we've looked at the D, which is the defibrillation. So the last thing I will talk about will be the choking, which is also short. Choking. Choke. I think earlier on when we started, someone mentioned choking. Yeah. I was there. Oh, okay. So when would you say someone is choking? Choking, what is it? Airway obstruction. Airway obstruction. It is a new insurance and social trial you choke here. Because it says that a solid object, including the airway, solid. You should cancel this one. Water, chilled water. So there should be a solid object that will obstruct the airway. So I don't know. You see, at times the thing goes through our esophagus, not the airway. Because cassia ever or esophagus, and it scratches the place. You feel that you are choking, but that's not the technical choking we are talking about. This should be the airway itself, not the esophagus. Airway. So when it happens, it can be mild or severe. If it's mild, it means that there's still space around that air can move in and out. So when you talk to the person can talk to you back, because for you to be able to talk, there should be air moving from your lungs out. But if the person can do that, maybe the thing is there, but there's still space. So such a person, they may be coughing. You just encourage them to continue coughing whilst you monitor them. And you call for help. Call for help in there, maybe out. So call for help and you monitor them. You encourage them to cough, because whilst they cough, the thing may come out. While they are coughing, it may now properly obstruct. It can become complete now. Initially it was incomplete, it can become complete. And such people usually will be holding their neck like this. When you ask them questions, they are unable to talk, so they know. Are you joking? That's what they would do. Okay. So with such people, what do you do for them? If they are choking like that? Always you have to ask permission to do anything when anybody says something. Before I said, no, baby, So you have to ask permission whether they want you to help them. If they say okay, then you help them. So we assume that he's the one choking. We are come to assist us. And so he is the one choking. I will need to do what they call abdominal thrust, also called the Heimlich maneuver. Okay. How do you do it? You make a fist. So my dominant hand, I'll make a fist. Where the thumb is, that thumb area will go into the abdomen, above the umbilicus, below the sternum. That's where it's going to go. Okay. Then I'll support it with the other hand. So I'll wrap my arm around him like this. Okay, he's the one choking. And that's where my fist will go. Okay, and I'll support it like that. Okay. I need to support myself because if I'm standing just like this, it's good. Okay, so I need to support myself. So I put my leg in between hers like this, and then I do that. Okay. I'm coming to move this one in up forcefully. So it goes like that. That's what I'm going to do. Okay. If you show, that's what would happen. So I do that still. He brings the thing out. Because when I do that, it increases intrathoracic pressure and it forces the thing out. So I didn't want to stand in front of you before the front of the moon.
Please do it.
No, I'm not going to do it. Yeah, that will be it. I'm not going to do it, but I'm just showing where the hand will go, and then that's the way I'm going to go about doing it. Okay. Whilst I am doing it, he may pass out. And the position that I am in, this position will help me put him on the floor. So if he passes out, I just lay him on me, go gently, and place him on the floor. So that's the way that you go. You gently put him on the floor. Okay. And once he goes on the floor, we are going to do our chest compression just like we're doing for the person who has passed out or who has had a cardiac arrest. That's what we do. But at every point in time that we need to give the breaths, we look in the mouth to see whether the object is in the mouth. If it's the mouth, then we'll bring it out. Okay, so that will be the approach. For a person who is normal size, who is not pregnant, that's how we go about it. Any questions on that one?
The hand you make the fist with, is it your dominant one?
Yes, my dominant one.
Always the dominant one.
I mean, if you think that your left is strong enough and that will go, you can use that. Yeah. So if the person is too big, obese, you see, my hand should wrap around, and this is the man is obese. The thing can go around like that. I rather come to his chest because normally when people are obese, their chest, it doesn't really affect it. It's their tummy that it affects. So I'll go around his chest with my hand the same at where we do the compression. And this time instead of doing abdominal, I'll do the chest. Okay, it goes for a pregnant woman too. But I can't go and be doing this on the uterus. I rupture the uterus. Okay, so it goes up there and I'll do the same thing. And if you should just have a cardiac arrest, just put it down and do the compression. That's how we do it for adults. People. Okay. You can sit up. Thank you very much. Yes. It's not out. Yes.
Then continue
Your chest compressions. Yeah.
before you do the breath check it.
Yes. Perfect. Perfect.
So why don't you go through the
Oh, dear. You see, it's not in cardiac arrest yet for you to do chest compression. It's not in cardiac arrest. To do chest compression. But when they are in the cardiac arrest, now you are killing two birds, isn't it?
Sorry.
When they get in the cardiac arrest, now you are doing two things. It helps you to achieve two things. Now you are compressing and you are getting the heart circulate, as well as it increases the pressure there and the thing can come up with that. But if they are not in the cardiac arrest, you just do the abdominal thrust to increase the thoracic pressure, and that will bring it down. Yeah, and I guess it's more hitting on the chest than the abdomen. Yeah.
What is causing the massive noise? When the person is choked.
So if it's choked, then it's complete. It means that air is not going down, oxygen is not going down, and hypoxia is one of the causes of the reversible cause of cardiac arrest. So the fact that they are not getting oxygen, they'll pass out along the line.
But
So yes,
when the person is choked, maybe you can just, when you do the abdominal thrust, the person will just bring the thing out.
Yes.
So the person will not pass out.
no.
So
Yeah.
if that one, you just
I
leave
mean
the
that
person.
one. If the thing comes out,
You
it's still
just
fully conscious.
Yes.
Yeah,
okay.
But we are saying that if you are doing it and the person passes out, then
Oh,
that's
okay.
what. But we are not you that. Oh, Baba. Sorry. You continue doing the talk, eventually you are called for help. Help will come. Get the patient to a hospital. And they may have to go and do bronchoscopy to bring it out. And actually, there was a nurse who Kumasi, he wait, child. He was eating with a girlfriend there. Watch it. And then the Gabruno, what he said in Sasina, and he has printed on it. But it was incomplete. So they tried that, I think it was sometime. He ended up in theater for them to bring out the Gabru. So after that, his name will be what? Gabru. Eric is for Gabru. I mean, it was serious. Like, I played that Gabru Ramanaye. I'm going to theater. Do bronchoscopy to bring it out. Yeah, so it happens. It happens. If it's an infant, the approach is slightly different, isn't it? You cannot get this child to stand for you to do something about to go on this child. So they do what they call the back slaps. 5 back slaps, and they do what we do, the compressions, the normal compressions that we do for them. So usually you need to sit or kneel such that you can have the head end should be pointing down. So you lay the child on your forearm, support the head like that, and you're going to do your back slap. So you do the back slaps. 1, 2, 3, 4, 5. That's what you do. It's not out. Then you turn the child onto the other one, like this. Then you do your compressions. Where you've been doing the compressions. You do 1, 2, 3, 4, 5. It's not out. Then you turn. You do this till you get the child to the hospital, or till it comes out eventually. So you do that 5. Then you turn. Then you do 1, 2, 3, 4, 5. Then you turn. Then you do 1, 2, 3, 4, 5. And that's how you do. For the infants, that's what you do. Back slaps. Any questions? From beginning till now. Any questions?
What about the child?
The child, you do the same thing. So the child, you stand, either you kneel behind them or so if this is the child, maybe this height, I can kneel behind them and do the helmet. Yeah. Yeah.
Gaps.
Any more questions? That's the last one we talked about. So now you'll be able to answer all your questions now. Have you got to know the answers, or there are some things there? Which are some of the things? It's not in your brain.
You have the question.
Sorry. Sorry.
If someone is capsule,
Yeah. So So when we talked about, maybe I should have added it. So if we check for the unresponsiveness for someone with cardiac arrest, we check for no breathing. So either they have no breathing or they are gasping. The gasping is not a normal breathing. It should be considered as abnormal breathing, gasping. It's also called agonal breathing. When they take it, by the time you go and check, there's no pulse. That breathing is abnormal. At times there's a pulse, but you know that So once you see someone gasping, it's not normal. You may need to support them to breathe well. And once you're able to support them to breathe well, it may prevent the arrest from coming. And if you don't, eventually the arrest will come. So agonal or gasping is not a proper, it's not abnormal breathing. So that's abnormal breathing. By ventilating, like doing a bag, but then you need to, the definitive thing will be to breathe. Not breathe the pulse there. And then I think someone asked about the rescue breaths. I mean, so when they have the pulse, you give what they call the rescue breath. So you breathe for them, but you don't breathe fast. No. Normally we breathe normally about 12 in a minute. So you give them about each 6 seconds. You give them one breath. You say 5 to 6 seconds. You give them one breath. So if you did that within a minute, you're giving them about 10 thereabout. Yeah, that's what you need to do to rescue breaths. Any more questions? Were you able to gather all the questions from the pre-test? Any more questions? All right, thank you so much for coming, and I hope that some of the things you've learned you will be able to apply them for your patients. Thank you. I think the next thing will be a post-test.
Can we try a scenario?
You want a scenario?
Yeah, maybe to be fine.
All right. So maybe you have 2 people coming to do the scenario. Okay, so they have volunteered you. Okay, so come here.
It has to be in the group, like in a hospital setting. Take my phone.
All right, let's go. All right. So you say the hospital said no, so they brought the patient to you in your radiology suite, and you identify that the patient has become very unresponsive.
Yes.
And that is the patient. What would you do? This one. Right. There's nothing there. Jeffrey. Okay, they are coming. Check the pulse. The pulse, check it. They want to see how you are checking it. Okay. He's not breathing and there's no pulse.
So I'll start the CPR.
Okay, start.
Then it's clear. He has imagined it clear.
Well, they are bringing it on their way. They are looking for the things. So. You know how when they ask for things, they are not looking around to get the things. So they are looking. Okay.
Your hand is jumping. Yeah.
So Jeff, you've come. You have come.
First, fast.
Go to the head side.
Your head side. You see that guy. Where's the chin?
So now you have
Killing himself.
And I was just doing.
Okay, so AED has come. So after I've got the I've opened it.
Stay clear. Mobile report.
Stay clear of patients. Deliver shots now.
Okay, so what do you do? Yeah, you do the CPR. Okay. So that's how it will go. It's that one. It's that one. So that's how it goes, right? Yeah, that's how it goes. Yeah, that's how it goes. All right. Any more questions? Any more questions?
So why you kill the patient?
All right. Thank you very much for coming, and then I think a post test is the next thing. Are you bring it here? Okay.
Let me look at the question.
We kill the patient. He didn't record me. He killed the patient.
Stop CPR. Stay clear of patient. Analyzing. No shock advised. Begin CPR.
Yes.
I mean, like,
here. But she'll come.
The defibrillator, how is it important? Is it 100% sure that? But that's the last step, right? So 100% sure that the person's airway is
Normal cardiac rate, right?
right. It shows 100%.
What's the option?
Why is defibrillator?
The answer, option. It can restore. When? How responsive? No breathing.
Begin CPR.
It's just real fast.
It's just recall.
And the defibrillator, what is the normal cardiac rate?
It can restore.
Irregular cardiac rate.
It can. I don't know.
This is the defibrillator.
It can restore.